Can I thank my honourable friend for his question and also for his campaigning on this important issue, and indeed for speaking so honestly about his own experiences during his time in this House. An additional £267 million has been invested this year to improve the quality and capacity of drug and alcohol treatment and recovery. We are committed to correcting the years of disinvestment in treatment and recovery services and ensuring that people can access the support they need. Mr. Speaker, attempting to exploit people with addictions is reprehensible. Yeah. Free drug and alcohol treatment is available in every part of the country, and I urge anyone who's struggling right now to visit the NHS addiction website. The CQC has said that it could take legal action against companies misusing its logo, and Google has said that it would remove search listings from these companies too. I'm more than happy to meet my honourable friend to see what more we can do to stop this outrageous activity. Social prescribing is one of the tools, and it's an important tool in addressing public health concerns in each of our constituencies. But look, this government is committed to ensuring that we get those shifts from sickness to prevention. We will be ensuring that local areas have public health funding in reasonable time. We're about to announce this year's allocations in due course, and we need to make sure that local systems maximise the use of their money, and that certainly includes social prescribing.
Minister.
My honourable friend raises a really important point here, and of course as part of the government's health mission, we are producing a 5-point plan for prevention, and alcohol harms is one of those areas. I hope to be able to update her and this House in due course on the actions we will be taking to really drive down the prevalence of alcohol harms and indeed other addictions, because it is costing lives and causing misery in communities, and that's why this government is determined to tackle these public health problems. The honourable gentleman raises a really important point here, and look, this government is committed to having the healthiest generation of children ever, and that means that we will have a concerted effort, Mr. Speaker, on a whole range of health issues that determine the health and well-being of young people, hopefully ensuring they become healthy adults as a consequence. Alcohol harms is certainly one of the considerations that we will be Mr. Speaker, we believe that every child deserves the best start in life. Due to the challenging fiscal context, we're prioritising family hubs and Start for Life funding to areas of high deprivation initially. We will consider the case for extension to South Cambridgeshire in future financial years. Mr. Speaker, local authorities were pre-selected using the income deprivation affecting children indices, average rank scores, with a rural and urban weighting applied. We know that tackling child inequalities in health and outcomes is absolutely crucial, and as resources allow, it is the ambition of this government to ensure that the Start for Life services reach every child. Mr. Speaker, I want to start by commending the honourable gentleman on his fundraising efforts to fight cancer in Surrey and his support for the brain tumour charity. We are committed to ensuring that people with brain tumours have access to more effective treatments and excellent care, including through our National Cancer Plan. We'll set out more details on this shortly. In September, the Secretary of State and I met with the families of those who have suffered harm following the COVID-19 vaccination, including his constituent Sheila Ward, where they raised the need for reform of the vaccine damage payment scheme. We listened closely to those families and what they've been through and agreed to look at a number of options, noting these may need to be cross-cutting government decisions. We're also working with NHS Business Services Authority to improve claimants' experiences of the scheme and ensure that claims are processed, and raises a really important point. Now, NHS England is is due to complete a stocktake of long COVID services throughout England at the end of this month. This will provide an accurate, in-depth overview not only of long COVID services, but also now of ME/CSF FS services too. The stocktake will provide a comprehensive and accurate national picture, identify key challenges and make strategic recommendations for future service improvement, development and assurance. I'm very sorry to hear about the Honourable Gentleman's constituent, Mr Speaker. I know firsthand how complex and debilitating long COVID can be. As I mentioned in an earlier answer, there is a stocktake taking place which should show where there are deficiencies. But let me make it clear, I want to ensure there are good services for people suffering with long COVID in every part of England.